Hello everyone, welcome back to my YouTube video channel. Again, I will be sharing another case and presentation. Let's jump right on, and we are talking about this particular case. Patient came in her middle of 20 with teeth showing a lot of teeth when she smiles. She have a very nice lip, very nice lip. So this is something that, and then also very nice enamel. It would be a great case to turn out if we're gonna finish this with braces. So here's another side view. This is before we started. Her two lateral incisor is doesn't have room, so it's lingually inclined, and the two central had to come out. The canine is sort of like in the right position. Lower teeth is crowded. And here's a close view. Really very nice lip. You know, even though she have almost like a protruded smile, but the side view look wonderful. Central incisor sticking out, and lower teeth grinding. And if you could get closer, you would see is because of the crowded teeth, she's having the worn out incisor on number 8 and 9 and 24 and 25. So you can see a closer view. As you can see, a little chip here and there, wear and tear from inappropriate bite. Okay, habitual bite, thing like that nature. Nice posterior bite, very nice on both sides, but the anterior is like that. You can see a closer view, really protrude 8 and 9, really incline 7 and 10. Nice arc, same thing on the bottom here. So what would you do? How would you handle this? Everybody agree that, you know, in order to create a nice profile, we need to eliminate the first bicuspid and then move the teeth back and straighten it out. It's going to look beautiful. So that's what we did. We started with bracket everywhere and unravel everything. Once we do that, when we are when the time comes when we take out the first bicuspid, the patient doesn't have any pain because already loose. That's the trick in dentistry for orthodontists, is when you able to take care of the brackets, put it on, and move teeth at the same time. When you take out the first bicuspid, it's very nice and easy. Patients love it. So here's a progress of the treatment months after months. This is before. This is first month started. This is second month started. You can see the teeth align pretty nice, really nice, without any teeth extraction. But as you can see that skeletally speaking, the teeth almost like very protruded. So for the female, this is not very very attractive smile, even though the teeth are straight. So we continue align them. You can see right there, A and I, the enamel are not even because of the previous malocclusion. So we end up took out first bicuspid and move back slowly. And so here's before, here's the progress. And wanted to show you the movement here, coming down, coming down, coming down from day one on the way, slowly move back teeth. A lot of work to put the teeth occlusion together. The patient getting better and better. So what I do is I just move backward, this one backward, and I don't believe I took out. Let me see. Yeah, it doesn't look like I took out the bottom tooth any first bicuspid, only top part only. So I did not remove lower teeth. Okay. Here is the next one. I want to show you. So here is the tooth removed. Right after we remove it, we put a closing coil, try to pull it backward. slowly with the power change, move backward. Also using the elastic on the bottom to lay on top to pull it down, intrude it, the bottom teeth. You can see that one tube at a time moving backward. Also use the keyhole wire to help to pull the teeth back segmentally, a whole segment backward. See the improvement there. Close the gap on number 4 and 6 backward. Create a space here. And then we're gonna retract the whole thing back. Come together, almost there. And this is some of the picture I took with randomly. So, but you look at the profile. This is like before we close the gap, skeletal really they protruded. You look at now up to midway, very different. The angle of the incisor here is totally different. You can see, just love it. Patient love it right here. Great result coming along. Some of the picture just randomly organized. So this is before, this is midway, this is midway, and we have to use elastic, class 3 elastic to pull the lower backward and move the inside upper arc forward because we didn't take in any first bicuspid on the bottom too. So you can see the result, you guys. Change drastically from here, down here, down here. Slowly but surely, result is coming along. Now it's almost closing to the point where nice and perfect before we take out bracket. This is really close to the end. Patient was super happy to this point. So you want to take it out and see this before. This is middle, this is after, before, middle, after. Great improvement. Patient love it. Beautiful result, beautiful enamel. So you can appreciate how much changing from the anatomy of the art, from where she is to now, from here to coming down here. Patient love her smile. Thank you for watching. I hope you. Oh, this is just a quick video with before we finish the treatment.
Welcome back to my YouTube video channel. Just take a look at the first consultation of this patient. He has some upper anterior crowding, lower anterior crowding, upper teeth crowding, lower teeth crowding. Difficult to smile. It have to be protruding. The teeth make me feel uncomfortable. Smile. Try to hire as much of teeth as possible as you talk. And so this is something that most patients have consciousness about their teeth when they don't feel good about the smile. However, after a couple of years of treatment, instead of the end of the result, you're going to see how beautiful the smile of the teeth look now. This is pretty amazing. Video which people who have issue with consciousness about the teeth.
Anyway, this is just a quick video, and I just want to continue showing her profile before and after, before and after, before and after. So here's the before and after. Thank you again. I really appreciate your time for allowing me to do this presentation. If you guys have any question or enjoy the video, feel free to make some comment and follow me with more new video. Thank you again for watching. I hope you like it. Have a great day, everyone. Please don't forget to subscribe my video on my YouTube channel. I'll see you next time.